Okay, great, thanks. So, next one. Yeah. Keep going. Back, the other way. I'm finished. No, that's it. I get Mario and okay, stop there. Okay, so these are some of the principles. Just to you know, as I've been speaking about this for a long time, and the other title of this could be the liberating experience of facing painful truth. However true that may be, I'm practicing law for almost 30 years. I'm waiting for somebody to call me on the phone and say, Dr. Epstein, can you help me face my painful truth? That's not what they say. They say the same thing they say to every other doctor. I got this problem, how are you going to cure me? What are you going to do to fix me? And I'm going to try to help them, and I'm going to try to engage them. But what you see on the right side is kind of the nature of medicine in terms of how we've evolved. We have doctors pretty much to be experts at the part. I got a bad knee. You know? I play golf. I have a tiger thing. And I'm in the process now of deciding whether or not I want to have surgery so I can join the wise men and play golf with everybody. But so I want a doctor who can treat the part. I go to a orthopedic specialist who can do my knee. And we treat the body. And I want the right diagnosis. I want my symptoms dealt with. I treat from the outside. Our drugs and surgery come from the outside and force the body into a healing thing, whether it's a drug or surgery. The doctor prescribes, and we're looking for a cure. That's good. This is now called integrative medicine. It used to be holistic. It used to be alternative. Then it got called complementary. I think integrative is a better word. It's kind of like we're integrating the salt in the soup. We need it all. We need the chicken, but we need the salt and the spice. So integrative medicine, the principles, what I focus on is the left side. Not to the exclusion of the right. I want to make sure the patient has that in their soup too. And mostly they do. They're seeing the top doctors in town. But they're not looking at the whole person. They're not integrating their mind, body, and spirit. They're treating the disease and not the person. Everybody with arthritis, it may look the same on the x-ray, but the consciousness and the life of a person is different, and the factors that are affecting them. Thank you. Oh, this.
If you like.
And the factors that are affecting them are different. So these are the qualities or the principles that we integrate from the standpoint of bringing them together. This is not either this or this. It's both and. Patient comes into my office with a chest pain. I want them to see the cardiologist immediately to make sure of what's going on in their heart and get tested. I'm hoping that someday the cardiologist is also asking, what's happening in your life? What stresses are going on? And recognizing that that's as important maybe into what's causing their chest pain as whatever's going on in their arteries. We need to integrate both of them in that regard. The problem with what I'm saying, the patient has to be involved, and it's not magic and it's not quick, and you can't do it in 10 minutes. It takes time. It's a process. This is about treating the cause. Now, as I said to you in that first story of that patient, it's not that the stress caused the psoriatic arthritis, but it was a factor contributing it that needed to be dealt with to help him in the healing and the recovery from it. Okay? When we talk about cause, I was a speaker at the University of Virginia School of Medicine, Family Medicine. They wanted somebody to talk about mind-body medicine. And I did a little bit of research, and the American Academy of Family Physicians did a study. 80% of visits to the doctor are for stress-related complaints. I'm speaking to 250 residents like I'm speaking to you. They're not arguing with me. They're not disagreeing with me. And then I say, well, how much training have you had in helping people manage their stress, since it's a cause of why they're in there seeing you? It may be psoriasis, it may be arthritis, it may be heartburn, but what's contributing to it is the stress in your life. Now, just like I don't have to be a cardiologist to say, go see the cardiologist, they don't have to be a therapist to say, you got to deal with this and to know that there's a connection. But when I asked how many people had had training in that, they didn't raise their hand. Not because they didn't think it was valuable, not because they didn't believe in it, because there's all these sciences, studies on psychoneuroimmunology and the mind-body connection. It's just the nature of the beast. It's hard to do in 10 minutes. We can't do everything. That's why we have to integrate it. You know, you get a little here and a little there. And everybody here, most of you retired, I'm gathering. You think this way about your business, about your career. If you're running a business, you got the marketing department and the sales department and the accounting department. If one of those parts isn't working properly, your business is going to be, you can't just have a great product, right? And it's the same in medicine. We think, oh, whatever, even if something is a knee or the heart, I have the best cardiologist, great. But maybe you need this part of the equation and this part of the principles of integrate to look at. And in this role, the doctor as a prescriber and as much a teacher. So there's a line that also helped me. I started as a Montessori teacher, not as in my medical career, but I learned that learning is natural. If you want a child to learn, you create an environment for learning. Healing is the same thing. So I'm trying to cure my clients by putting the right curing things in their soup, mine and whatever other doctors can put in, and integrate them. But mostly I'm working to help them heal. And if healing happens, they have to be involved. And sometimes to do our curing, we have to heal. Bill Clinton had bypass. It only cured him if he did his healing and got forgiveness from Hillary and dealt with his emotions and changed his diet. Then he was healing and curing. We want to do both of them. So the next slide will show the difference between healing and curing. Again, we need both. Curing is rational. There are answers. We want results. It's quick. We want to know what to do about it. We want the expert. We have the procedure, the remedy. As I told you, right now, I'm dealing with a torn meniscus in my knee. I'm looking for the best surgeon to do all of that, right? But then I got to look at the paradoxical side, the healing side, the questions, the process. How long is it going to take? How can I be with this pain? You know, I have to rely on myself and in a relationship instead of just somebody's going to do it for me or to me. So that's the understanding of how to integrate those. Go to the next slide. Engage the patient, the doctor, the clinic to consider and integrate all of the above. Both and, not either or. Sometimes what a person needs for healing is a hug. I had a patient, she had multiple sclerosis. And there's no cure for that. And she's seeing a neurologist and she's getting some medication, she's getting help and she's being treated, and she's getting depressed. Not fun when your body is breaking down. When I teach at the senior center, part of most of my teaching in mind, body health is just helping people relate to and be with what's going on for them in a wise way, in a compassionate way, in a Tuesdays with Maury way. Everybody has to find their way to deal with that. This woman had multiple sclerosis, and she had good medicine. She came to me as a naturopath looking maybe I could give her a special diet that was going to reverse her thing. And I'm not here to talk about nutrition, but nutrition is also an important ingredient. It's not a magic cure, but when you look to get healthy, it's not complicated. Is there a connection between your diet and your health? And is there a connection between your stress and your health? And never heard anybody eating a healthy diet, and I never heard anybody helping them learn how to deal with their stress better. Either it's going to contribute and help them heal, or it's going to make them stronger so that they're dealing with something that can't be cured, like Maury and amyotrophic lateral sclerosis, and it helps them face it and deal with it. Norman Cousins, Anatomy of an Illness, Biology of Hope. Don't deny the diagnosis, defy the verdict. So this woman with multiple sclerosis, I said, how has your life changed? And she started getting into a wheelchair. She was withdrawing. Her life was withdrawing. She was trying to find her friends, and nobody was coming over, and she was kind of getting depressed, and you could see the slippery slope of her mental condition being exacerbated by what was happening to her body and having a disease like multiple sclerosis, and it getting worse. And we were talking, and she says, well, tell me about yourself. And she loved the opera. And she stopped going to the opera. So, you know, my prescription was, you know, I have to help this lady get to the opera. That was her life, you know. I mean, for me, it's not the same kind of thing, but I'm going to go through whatever I have to go through surgery-wise because I got to play golf. I enjoy it. If I can't play golf, I don't, you know, who wants to retire if you can't play golf, kind of thing. So you do what you have to do. I had to get to the opera, but she didn't want to go, and she was shy, and she'd never been in a wheelchair before. She didn't want people pushing her around. She didn't want people to see her like that, her friends, and so she was hiding. And so I got one of her children, her son, to come, and we actually took off a Saturday, and I went with her to the opera. And she confronted her fears. She saw her friends, she got involved, just like you guys when you come here on a Thursday morning and, you know, tell each other jokes. What was that? That was a great one. Close the legs. I'm going to use that. I'm going to find that guy and remember it. There he is.